For me, the reasons that brought me to come and participate in the program were basically to see what's new in the field of education, what is new in the field of maternal and child health.
أنا عارفة الكونديشنز عندنا ازاي في مصر، وده أنا أقدر أحور السيستم هنا وأخليه ينفع السيستم المصري.
I solemnly pledge to uphold the standards of my profession. You're gonna be okay. I will devote myself to the welfare of my patients.
And constantly endeavor to increase my knowledge and skills and to use them wisely. I'll remember that I'm a loyal member of a team with special obligations to all my fellow human beings.
May I always act to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help.
This is a story about different people from different parts of the world, different language and different religions. They share one common principle, the meaning and purpose of their oath. More important, their visions of the meaning and purpose of being a human.
You can do good work from anywhere. We work on 5 continents. We work in women's issues in Kyrgyzstan and conflict prevention issues there. We work with disability people in education and disability in Ukraine and in parts of Russia. We work in Indonesia with youth and with religious leaders. We work now in public health in Morocco and in Egypt. So we work all over the world.
All over the world.
We're all over the world from Bedford, Virginia.
I am one of the 2 directors that this project has. I am the director in charge of the training and development of the community health internship fellowship.
You can give him IVs. You can do an IO. It actually goes right into the bone.
It's a very exciting opportunity to reach out into North Africa, particularly Morocco and Egypt, and use this U.S. government initiative funds for bringing healthcare professionals who specialize in marginalized areas, rural areas as they pertain to mother and child health, and bring them to this country to see models of projects that have taken place here, initiatives that the United States is using in a rural setting, and we are using Roanoke, Virginia as our small city/rural area to show the fellows the models that we are using in the United States.
We have a control room right here that we're actually behind, and it's obviously you can't see in there, and we can see out, and so we're watching and looking what they're doing. We have speakers and we're listening to what they're doing. So we change the mannequin depending on what they're doing. There's obviously a protocol and stuff that they should be following, but if they do mess up, we let the mannequin mess up so they see what happens. So here it's not, they're messing up here before they do up on the floor.
At Roanoke Memorial, we are an academic medical center. We are accustomed to having a number of students here. We do on a regular basis. We have residents, pharmacy students, fellows. We have students from every country, almost on any given day.
I will not do the comparison between Morocco and United States, but here, for example, there is, I think, 12 patients, and nurses, I think that's one nurse for 2 patients.
Yeah.
And all about monitoring, a big team.
Yeah.
So
this particular approach permits the person who lives in that environment, who is interested in changing their own environment, to have ownership of that change.
Yeah.
So we're providing the support that permits these young professionals to look at their community, create their own solutions, and then execute plans.
the problem is who use this technology, because in Morocco we have a lack of resources, human resources.
Yeah.
So we can implement technology, but first of all we must before using this technology learn about it. So we must have an education or instruction about this technology.
I think it would be very beneficial if you can give us some hints or tools about how to approach people and how to be able to bring your idea to life.
Okay. You are all humanitarians, all of you. And you have one thing in kind: serving humanity. That is the bottom line.
Dr. Harold Robles is the co-founder and president of the Medical Knowledge Institute. He has devoted his life to promoting healthcare education as a human right. Dr. Robles holds a PhD in public health. Recently appointed distinguished visiting professor in public health education at the American International College.
3 children were operated on, cut open, all the body parts taken out and sold, and then buried. And I stood in front of the president of the country and I told him, you are abusing the rights of children.
I have a dream that the church and the mosque can be united in one single institute that is concerned with public health and promoting health education in the
Morocco has started with the Morshidat, the leaders. They hired a lot of women with degrees of religious science, and she hired them in mosques, so they have to speak with women and to explain everything for them regarding education, their health.
Basically what is happening is that the resident, the intern or the resident is presenting the patient to the attending. And they're basically given a 24-hour, like what has happened in the last 24 hours since their last round in the ICU. And so they're taking that, they're talking about the patient, and they're deciding on the plan for the next 24 hours.
The oath, for those who live by it, is not just a bunch of statements. It is not just a set of attitudes or just a guiding set of rules. The oath, simply put, is a way of life.
Human beings share universal values. Everybody tastes compassion and mercy and patience and understanding. Everyone cares about freedom and justice and love and tolerance. Now, to different degrees. And people who are motivated strictly monetarily or politically, well, then we see a lot of corruption comes in. But the average human being, people to people, they care about the future of their children, the food on their table, the quality of life that they have. So that means we have to address food and water and rights of individuals, but from what basis? Universal values.
Sharon and I have done some programs that teach people how to help moms in labor to decrease pain and deal with pain and position change and comfort measures. And so they wanted to do that to encourage moms to come to the center to give birth, to make it a better, a more welcoming, I guess, place.
In areas where the healthcare provider is male, And even if you have a very motivated person, there is always the barrier of culture and tradition, that they are not, able to get that message across.
Right now we're allowing the students just to kind of walk through and put their hands on stuff and just allow them to kind of work through some stuff.
Learning by doing.
Yeah.
هي حاجة جميلة جدا.
They're not looking at us in a different way because maybe like we're Muslims or veiled. No, it was very friendly and everyone was.
It's good to know.
Yeah.
Work is love, makes visible, right? Khalil Gibran. Could living the oath and the love of work extend beyond the workplace?
We have the same principle in the life, working, having nice time with the family.
Yeah.
Yes.
Caring for others.
Yeah, caring for others.
We visited the Moroccan medicine researcher, Ayman Droundi, and her American's host family to find out.
Did you tell Iman about the guy who asked if there was halal pork?
Yeah, in our orientation meeting with Legacy International, we were discussing the food aspects.
One of the hosts asked that.
Yes, and
yes.
they mentioned the Muslim. They won't eat the pork.
Never eat pork.
Products.
They know well their class.
Yes, but then someone raised their hand and said, "Well, is there halal pork?"
They have to satisfy us that the person who's applying is really eligible to receive this very big opportunity. It's like receiving a big scholarship. They should be somewhat of a leader in their own community, so we don't just accept anybody because we're interested in them receiving some more skills and then adding to what they already know, so when they go back we can create this multiplier effect and they can help in turn the people in their own communities.
The moment has come for the fellowship and the host families for a final farewell's hug. Fellows returning homes are required to implement a local health care projects at their community level. To support the design and implementation of the local projects, Legacy International offers optional mini-grants. The American professionals offer multiple consultations and public information sessions. Here are some sample.
احنا بنرحب بضيوفنا ليجاسي انترناشونال في مصر عموما وفي امبابة خاصة.
I learned with Legacy many information about public health and reproductive health issues. This is very important for me and for my work and career.
Ms. Mary Samia leads trainings and organizes workshops to overcome cultural issues. She is educating youth and women about sexual health, violence against women, and hygiene. She has taught classes primarily in Cairo and Upper Egypt.
No, يعني لا بمعنى كلمة لا، فاهمين الفكرة؟ فهي تقصد كده، تقصد إن المجتمع كله مليان، مش إحنا في مصر، في أمريكا هنلاقي، في أي حتة نروحها هنلاقي، بس أنا في إيدي مفتاح قراري، أنا اللي أقدر أحافظ على جسمي، أنا اللي أقدر أحافظ على نفسي، وأقدر إن أنا حتى لو عايشة في بيئة صعبة، أنا بإيدي أقدر أغيره.
فالبيت ده دول انا اتفضحت او اتشهرت في كل ده والناس كلها عرفت ان حصل لها قضيه تحرش. يعني ما بتبقاش جوه الاسم بس، ما فيش اعلان، ما فيش حاجه، لا بالعكس، ده الاعلان بيدخل في الاسم.
القانون اللي احنا بنتكلم عليه دلوقتي اتحط بسبب ان واحده تجرأت وراحت بلغت وصممت انها تاخد حقها.
In Egypt, we believe in, because I'm a girl, I can complete my education. Because I'm a girl, you can't save yourself. Because I'm a girl, you can do anything like men. So I'm thinking about because I'm a girl. I need in my vision to my project to change behavior for a girl. So I think I need to transfer my idea. Because I'm a girl, I can change our world. Because I'm a girl, I can development Egypt or development something in Egypt. Because I'm a girl, I can continue my education. Something like that.
We don't have that big gap between us. I mean, this gap is in our minds only. We can do anything.
Dr. Elfar is seeking to learn more about the remote diagnosis and treatment of patients by means of telecommunications technology.
This is the island of change. The others will feel that this should be the level of healthcare in Egypt.
His motivation for that is to reach the rural populations. He wants to develop an early detection program to prevent childhood eye cancer.
The great thing about this program with Legacy is, yes, those individuals have come here. We have provided them with additional knowledge to enable them to have more confidence and an ability to look at their own communities and create programs. But then we follow that up with a visit.
It's not very common to really educate the parents a lot about the disease of their child here in our practice.
But why it's not common? Why it is difficult?
I mean, in the hospital where we work, we treat a lot of patients. We have so many patients, so we have very little time to talk with the parents.
I'm seeing a slice of the Moroccan family life, not something touristy. But seeing how Moroccans live every day.
In my training in Caribbean Clinic, I saw many services: antenatal, delivery service, breastfeeding service, and I was very impressed by the way of communication between professional health and health professional and between patients.
The way we are is the way we believe we are. Change what we believe about ourselves, forced to change bad habits. This initiative is designed to improve self-perceptions in rural communities in Morocco and Egypt.
What I believe. Since you chose to be a midwife, you have to deliver the message. You have to respect the woman's privacy. You have to do your job with conscience. Otherwise, we have no space for such midwives. They demanded us in the application to come up with some kind of project that you can implement in your region. So what I thought about, because of I thought that the very interesting idea would be to teach traditional birth assistants how to assisted delivery, how to distinguish a normal birth from a complicated one. And in case of a complicated delivery, you don't get help. You have to call the ambulance yourself. You have to prep the woman for transfer. You have to convince the family of the importance of transferring the woman to higher level of care. You have to do everything by yourself, and you have to accompany the woman as well.
Yeah.
So it's really a lot of work. And what really frustrates me is that you do not get any kind of help.
I'm thinking that what you would be doing is not only training midwives, but then you would be reaching the moms, and then the message could get from the moms to come more to the center, and the midwives would be trained to not only provide the medical care, which they are quite capable of doing and quite good at doing, but provide the support care.
It could be billboards, or it could be some type of public service announcements where the women could see this, hear this, and see the need to come to the birth center. But I think it has to be a hand in hand. You want to have a safe environment for your birth center so that women will want to come.
The more I'm doing this work, the more I realize the essential importance of public health as an umbrella topic that covers under it many other facets, and it binds people and links people together. It's a subject that doesn't know borders. It doesn't really apply to just one ethnicity or one religion, and I think it's one of the best initiatives that the U.S. government can take.
You can educate them to come, but at the same time work with the midwives to create a softer side, to create a place where women will feel like, you know, this is safe for me to be, to kind of bring home some of the home-like things. We talk about that a lot in our childbirth classes. How do you bring maybe some sense from home, be it a pillowcase or having a support person there, someone that can empathize with that woman to where she feels that she can relax and give birth there. So I think that much of what they're doing would complement what you're striving to do as well.
Americans have an amazing ability to be welcoming and to be hospitable and to show their warmth. And that's what our North African delegates are pointing out to. They are just very impressed by the hospitality and the openness and the generosity of spirit that they're receiving from the American counterparts here.
The Community Health Initiative, to me, is one way that embodies everything we do. Because if you think about what community health initiatives have to deal with, they're dealing not only with diseases like HIV/AIDS or hepatitis C, you're dealing with women and children's issues, pregnancy issues, you're dealing with food, almost everything that we do, leadership, NGO development, capacity building, citizen participation in their own well-being, because one of our mottos is help me to help myself.
Help me to help myself is serious business for any professional organization. Therefore, the oath must embody meaning through usage. In other words, the oath must maintain credibility to business people and to the wider public.
I know that MKI cannot change the whole world, but every day we are training 10, 20, 30 people how to take care of their own health and the health of their community. That is what I call making a difference.
I am working on creating a different mindset for them in terms of how they should think about their projects, how they should think about all the different steps that are involved in project planning. And this is a very new way of thinking for them. It's a way to show them how in the American mindset we think about project planning step by step. What are the resources needed, the exact budgets that's needed, the personnel, the staffing, all of that. So when they go back home, they will have a concrete plan that they can start executing once they go home.
What makes two American nurses leave their home, coming from the United States, and come here to Morocco to do that. Why?
She touched our hearts. She touched our hearts. When you meet someone like Aisha and Fatima, who are doing everything in their power to create a safe, good birth environment for women, and yet they have so many challenges, it is so inspiring to us.
Yeah.
And I think, I know for me, it makes me want to do more.
The projects also, I'm trying to tell them not to be too ambitious, something that's concrete, that's realistic, that's doable, that has a beginning and a middle and an end. That's what I'm hoping that they can achieve.
Right now, the project is on its way. And basically, when I contacted the local association that I will be working on, and I explained the purpose of the project, they were very excited. And the project, by the way, is about really trying to look inside the community and find people that are motivated to do the education to their peers.
This is one of the biggest requirements of this grant, is for the fellows to return home and to gather all of the information they have acquired here in this country, and to go back and to help their fellow countrymen through a project that they will be implementing.
The project was really amazing. The project that we worked on with different people from multidisciplinary backgrounds, for saving patients of severe acute malnutrition, was very rich. I can say it was really a rich experience.
First of all, they were very hospitable.
Who are they?
Legacy International. Every member in Legacy were very kind to us. Actually, they cared about everything, about our visit, everything. Even the smallest details, we were impressed.
Thank you.
We'd like to thank them back. By name, Laila, Mitra, yes, of course, Mr. Rash. Thank
Matt,
you. Matt, yeah.
Kevin.
And Kevin.
Everybody. Barbara
And you.
and Taya.